Good day everyone, welcome to Food Science and Technology 3 FST 370S. Today we are going to explore food irradiation. It's a technology that sits at the intersection of food safety, preservation and innovation. Now, before we get technical, let me ask you something. If I told you that your spices, your potatoes, or even your chicken could be preserved using irradiation, would you be comfortable eating and consuming it? That question is not just for consumers, it is also for food scientists and future food scientists like you. So by the end of this session, you should not only understand the science, but also be able to defend it. In this chapter, if we look at the overview, we are going to talk about why irradiation processing and compare it with conventional heating. We are going to look at the principle and the mechanism of action of irradiation. We are going to talk about the technology of the process, the application of irradiations in the food industry, and the disadvantages and disadvantages of irradiation. So, let's take a step back and look at this bigger picture. Food irradiation is not just about killing microorganisms. It's about food safety. It's about shelf life extension. It's about process innovation and consumer perception. So let's think about it this way. You want to compare irradiation with traditional preservation methods like heating. So we know what heating does. Heating cooks, denatures, and sometimes damages the food. So an alternative such as irradiation, on the other hand, works at a molecular level, often without significant heat. Food irradiation is not new. If we look at this pictorial representation, research dates back to the early 20th century, and by 1963, the FDA approved radiation for certain products. So there's been irradiation intensive research that has been happening even from way back as early as 1945. But you see what happened. This is where things get interesting. There was a U-turn in 1968. And the question is, why this U-turn? This U-turn in terms of reversing this decision to do research and apply irradiation in food products. It is because at that time, high doses of irradiation caused quality deterioration of the food. So the industry shifted. They shifted from sterilization to controlled lower dosage applications. And so this is an important lesson because technology evolves not by perfection, but it evolves by correction. So by 1983, the FDA approved the irradiation as means of controlling microorganisms in spices. By 1985, there was an approval where FDA was allowed to use irradiation for strawberries, poultry, ground beef, and also pork. Today, we have a number of irradiated products in the market. Now, let us address the elephant in the room. Is irradiated food safe? This is usually the first and certainly the most general question posed by the merchant and the consumer. Over 30 to 40 years of research across multiple countries has shown no harmful effects. So let me give you an example. Spices are one of the most irradiated foods globally. And the question is why? It is because they carry high microbial loads and thermal treatment will destroy their flavor compounds. So irradiation, in the case of spices, allows us to maintain quality while improving safety. So these investigations and money that was spent in this research of 30 to 40 years had a number of unequal scope, and they've been carried in many countries on test animals and animal feeding studies. and in no single case has any harmful effect been substantiated. So in 1970, the International Food Irradiation Project, IFIP, was launched. And so 3 international organizations, which is the FDA, Food Agriculture Organizations, the International Atomic Energy Agency, IAEA, and WHO, the World Health Organization, sponsored this IFIP project. So the aim of this project included 25 countries to participate, was to prove the general safety and the wholesomeness of radiorized food. And South Africa is one of those countries that participated in this study. So what then happened is that in November 1980, an expert committee of world food experts was convened in Geneva, Switzerland, to assess the wholesomeness of radiorized foods. The research results that were submitted to this committee dealt with the radiation pasteurization of food using doses not exceeding 10 kilogray, which amounts to more than 90% of the application of the radiorization. The expert committee concluded then that all food processed in this way are recommended for clearance. So the maximum dose allowed in South Africa, in line with the recommendation of the Codex Alimentarius Commission, is 10 kilograms. So the radiorization in South Africa, in our context, is monitored by the Department of National Health and Population Development according to the standards that are established more than 50 years of research by scientists throughout the world. So this directorate, the DNHPD, prescribes the conduct and safety procedures to be followed by the personnel that is operating food irradiators. So these procedures, what they do is that they ensure that both operators and the environment are safeguarded. So in the case of South Africa, in terms of this legal status, the Directorate for Food, Cosmetics, Disinfectants and Hazardous Substances prescribes the conditions and procedures that needs to be applied for food which is going to be irradiated. And so this is going to include labeling requirements. So if we ask the question, is radiorized food completely safe? We look at the study that was done by De Bruin in 2020 in the case of South Africa. So where they showed the yearly sales figures of shelf-stable food products, and then you can see that there is an increase on this graph that is on the left. And then they also looked at consumer responses to information with regards to radiorization. So we see that there was, for example, a question which asked them about their perceptions of these foods prior and exposure to information and then after tasting. So they said they would consume, they are likely to consume radiorized foods after it has been tasted. So in South Africa, the maximum allowed dose is 10 kilograms, which is aligned with Codex Alimentarius. And the process is, as I said, it's regulated by the Department of National Health and Population Development, and importantly, labeling is required. I think this is critical for transparency and consumer trust. So as professionals, you must understand both the science and also the regulatory framework. And this is something that I mostly stress in our classes, that the regulatory framework is very important to understand. So in the case of South Africa, if we look at data, what we see is that spices and herbs are one of the most really radiorized products, followed by fresh garlic and then honey. And then you also then have things like pet chews, dried vegetables, and fresh fruit. So you can see that there are a number of products that are radiorized in South Africa. But what I also want to bring to your attention is that in South Africa, we've got 3 radiation facilities. One is in Johannesburg, another one in Durban, and one is here in Cape Town. So before we close and wrap up, I want you to take this a step further. In the comment sections of this video, tell me about a food product that you would choose to irradiate. It could be something as simple as spices, or something as innovative like a ready-to-eat meal, or an insect-based snack, or a bambara-based snack, anything that comes into your mind. And I want you to then explain why you would use irradiation in that product, what your main objective is it safety, is it shelf life, or is it both? And which approach you would use for or you'd apply. Is it radiorization, radiosedation, rapidization? Keep it short and make it scientific. And don't stop them, and go in the comments and also respond, at least to one of your classmates, and agree with them, challenge them, or improve their idea. I think this is how we're going to learn, given the disruptions that we are going through as a university. Thank you very much.